Welcome to the National Highway Traffic Safety Administration's School Bus Driving Course, Transporting Students with Special Needs. This module's purpose is to review procedures for transporting students with special needs. The review will include an overview of the equipment you might encounter and how to transport students using that equipment. This course will review the Individuals with Disability Education Act, common disabilities, equipment you might encounter, wheelchair loading and securement, emergency situations, and evacuations. Let's start with the law that makes all this possible. On November 29, 1975, President Ford signed into law the Education for All Handicapped Children Act, the Individuals with Disability Education Act, or IDEA, was created in 1990 and is a modification of the Education for All Handicapped Children Act. The law ensures that special needs students receive free, appropriate public education in the least restrictive environment necessary to meet the student's needs. This includes all related services those special needs children might need. What does this mean? Schools are mandated to adapt instructional curricula to meet the individual needs of each student with a disability. This also includes any type of special transportation accommodations the student might need. IDEA is also protected and enforced under the Rehabilitation Act of 1973, Section 504, and American with Disability Acts of 1990. Title II rights of IDEA, eligible students with disabilities. Now we're going to go over the Individualized Education Program, better known as the IEP. The IEP is a legal document under United States law that is developed for each public school child in the United States who needs special education. The IEP lays out a program of special education instructions, services students need to make progress and thrive in school. Transportation falls under services a student might need. Now let's go over the Family Education Rights and Privacy Act, better known as FERPA. FERPA was signed into law by President Ford on August 21, 1974. The law protects the privacy of all student education records. Generally, schools must have written permission from the parent or guardian or an eligible student in order to release any information from a student's education record. When a student reaches 18 years of age or attends a post-secondary institution, he or she becomes an eligible student, and all rights under FERPA transfer from the parent to the student. FERPA allows schools to disclose the records without consent to the following parties under the following conditions: school officials with legitimate educational interest, other schools to which the student is transferring, specified officials for audit, evaluation purposes, appropriate parties in connection with financial aid, organizations conducting certain studies, accrediting organizations, to comply with the judicial order or a lawfully issued subpoena, appropriate officials in case of health or safety emergencies, state and local authorities with juvenile justice system pursuant to specific state law. Transportation falls under the school officials. They only receive the information they need to transport the students safely. What does all this mean to the driver? Schools can release information to the Transportation Department and drivers that is protected under FERPA. If there is need to know, such as student address and phone numbers, student disabilities, a student's health condition, such as seizures or hemophilia. As a school bus driver, you have access to student information that is protected under FERPA. It is illegal for you to release any of that information. There are some exceptions. You can release that information to other school officials with a legitimate need to know, appropriate officials in case of a health or safety emergency, and state and local authorities. Remember, it is illegal for you to give this information to the public, other drivers, transportation assistants, a school official with no legitimate reason to know. We cannot talk about a student's specific traits or disabilities in public. You never know who is listening, and it's against the law. All bus drivers know every student is different. Now we're going to go over some common disabilities and behaviors of special needs students. In this section, we will go over some common disability of special needs students. They will include autism, deaf and blindness, emotional behavior disorder, orthopedic impairment, significant developmental delay, specific learning disability, speech-language development, traumatic brain injury, and visually impaired. Let's start with autism. Autism is a developmental disability that affects language development, communication, and social interaction. It is a spectrum disorder. Children can be affected to a larger or lesser degree all along the spectrum. Students with autism may exhibit some or all of the following characteristics: repetitive movements, such as rocking or hand flapping, difficulty making eye contact, may not like to be touched, may engage in challenging behavior such as hitting, kicking, scratching, disobeying, crying, echolalia, repeating what they hear, exhibit unusual responses to sensory stimulation, and be resistant to changes. What does this mean for a school bus driver transporting an autistic child? As a driver, you want to maintain a consistent routine as much as possible. This will help to successfully transport a student with autism. Some other things that we can do: make sure the student is able to rock. Remember, a student with autism may avoid eye contact. That doesn't mean they're not listening. Students' responses to stimulation can be very unexpected. They may wander towards something that they like or away from something they don't like. Students with autism may not react well to negative commands. Give them choices. Let them think they have the power. Remember, they may repeat what they hear, and this can become very disruptive to drivers, TAs, and other students on the bus. Let's all be aware that students with autism exhibit a wide range of intellectual and behavioral differences. Some students do not communicate, or communicate in a meaningless manner, or have emotional outbursts, abnormal reactions to sound, hyperactivity, lethargy, abnormal responses to objects, abnormal fears, and a difficulty communicating with others. Now let's discuss deaf and blindness. The student may have a loss of vision, the loss of hearing, or both. Student may have the loss of hearing or vision ranging from total to partial. When a student has the loss of hearing or sight, they may make overly loud noises to get attention. They may appear to be ignoring you. They may not follow verbal directions. They may talk loudly. They may become upset if you cannot understand them. What does this mean for the school bus driver? Students with a loss of sight will need to be guided onto the bus and to their seat. It is best to assign them one of the first few seats. Students may have a white cane. It will need to be stowed safely within the student's reach. Remember, they need it to walk. Students may have a seeing eye dog. The student may be both deaf and blind, so give them all the help that they need. To recap, students with hearing or visual impairments require very specialized planning. Consistency in seating, communication, and daily management are required in order to minimize transportation problems. Students who are deaf or blind react positively to a daily routine and are easily distracted and upset by sudden change. Now we're going to talk about the intellectually disabled student. Students' intellectual function is well below average, and there is evident limitations in adaptive behaviors such as maturity, independence, responsibility, and school performance. Students may have this in different degrees. When it is mild, students generally have a difficulty with academic content, but can usually acquire basic reading and math skills. Immaturity may be evident, as well as an inability to transfer and apply information learned in one setting to another. Difficulty articulating needs and wants is common, and a change in their routine may cause confusion. In the moderate group, the learning level may fall 30 to 50%, lower than expected for chronological age. Delayed motor skills, poor retention skills, and immature social skills are seen. Delays in processing language are typical. Consistency and structure is necessary, and frequent repetition of directions or instructions is very important. Patience is essential in creating a safe and enjoyable ride for these students. Severe and profound is the last degree. Students in this group frequently have coexisting disabilities: vision, hearing, seizures, etc. Communication skills are limited, and self-care assistance is needed for tasks such as toileting, dressing, and eating. Assistance will be needed when boarding and disembarking the bus, as well as frequent monitoring during the bus ride. This disability can cause the student to be non-ambulatory. School bus drivers should be aware that students who are intellectually disabled demonstrate a broad range of abilities and functional levels. The student may be ambulatory or non-ambulatory. We need to work closely with the student's teachers to learn how best to communicate with the students and to find out what their triggers are. Let's talk about orthopedic impairments. Students in this group have an orthopedic impairment which impacts educational progress to the degree that special education is required. Impairments may have occurred due to congenital conditions, deformity, absence of limbs, diseases such as polio, cerebral palsy, and amputations. These students may use wheelchairs, walkers, crutches, or other assistive equipment. The impairment may be the result of other chronic health problems such as asthma, diabetes, epilepsy, or a heart condition. Students with orthopedic impairment may or may not have an intellectual impairment. Many of these students are served primarily in regular classrooms. The nature of the disability may require significant transportation adaptations, such as a lift bus or having to transport a walker and a wheelchair that the student uses. Other health impairments such as limited strength, vitality, or alertness may be present in the student. Because of the varied nature of students who are included in this category, it is important for the driver to get as much information about each student as possible and to work closely with parents and teachers in order to meet the student's transportation need. Adaptations may be noted in the IEP, and emergency medical plans may be needed. Let's go into significant developmental delay. Typically, students are ages 3 to 5 in this group. They have delayed development in intellectual communication, adaptive behavior, social, emotional, or motor skills. Students in this group may have to be transported in a child safety restraint system as determined appropriate by state or federal regulations, and manufacturer guidelines appropriate for size, weight, and physical condition. Typically, these students will be in pre-K, kindergarten, and first, and may include Head Start programs. Students in this group may go full days or half days, and the drivers should be familiar with all the child safety restraint systems that they may need. Let's discuss specific learning disabilities. Students in this group have a disability in one or more of the basic processes involved in understanding and using spoken or written language. The disability may manifest itself in an imperfect ability to listen, think, speak, read, write, spell, or do mathematical calculations. Some common characteristics may include difficulty with retrieval and transfer of information, reversing or transposing letters, difficulty knowing left from right, distractibility, and poor self-esteem. It is important for the driver to be aware that students in this category have average or above average intelligence, but may have a serious academic deficiency not consistent with their measured ability. Because school may be a frustrating experience for some of these students, the school bus ride can be a time when anger is expressed. Let's talk about speech-language development. Students in this category have differences in communication skills so significant that it is apparent, disrupts communication, or affects emotional, social, or intellectual growth. The impairment may be in the ability to articulate speech, sounds, or to comprehend and/or use language. The student may have difficulty in communicating. Because of the emphasis on early intervention, students in this category are usually very young. This can also be caused by other physical impairments or deafness ranging from partial to full. Let's talk about traumatic brain injury. Students in this group have received an injury to the brain after birth, which results in a disability that adversely affects the student's educational performance. The student may be angry, embarrassed, or depressed. A student with this type of injury may require special seating, a protective helmet, or other special adaptation. Remember, students in this group often require very specialized transportation planning because of limited physical, behavioral, or intellectual abilities. Students who have suffered a traumatic brain injury were not born disabled and may demonstrate extreme frustration trying to accept changes to their physical, behavioral, or intellectual status. Let's talk about the visually impaired. Students whose vision interferes with the functioning in a regular school program will need special needs transportation in most cases. This term includes students who are functionally blind, legally blind, or partially sighted. Most students in this category have normal intelligence and learn well when appropriate techniques, materials, and equipment are provided. These students may need guidance to get on or off the bus, and they function more successfully in a setting with assigned seating. The degree of intervention required depends on the student's ability to function independently. Here are some strategies you can try. Use verbal direction. Communicate things in advance if possible. Do not enter the student's personal space without telling them. Most students crave independence and may become angry if you over-assist. There's so much to think about, but I would like to stress a few more points. Drivers need to know enough about the student's disability to know what impact it will have on transporting that student. Some students have cognitive limitations that affect their ability to understand your directions. Some students may have disabilities that affect your ability to communicate with them and their ability to communicate with you. Some students have unusual or unpredictable behaviors that may startle you if you aren't prepared for them. Knowing the unique characteristics of the students you transport will help you to react correctly. Remember that students are people first, and then they are people with disabilities. Treat every student fairly. Always treat your special needs student the same way that you would treat any other student of that age. Be respectful. Don't talk down to the student. Be positive and encouraging. Allow as much independence as you can safely afford. Learn the language of the students on your school bus, both verbal and nonverbal. Different disabilities call for different equipment. Students with special needs may use a variety of specialized equipment requiring special care and use. Now we are going to look at some of the equipment or assistive devices you might encounter as a school bus driver of students with special needs. Let's start with walkers, braces, or crutches. Students may have to use walkers, braces, or crutches to get to the bus. Students may need assistance walking up the steps and to their seats. We must be able to safely transport whatever equipment the student might need. All adaptive equipment should be adequately secured during the bus ride. Walkers, crutches, etc. should be strapped to the bus seat or the wall. A large size walker should be secured with wheelchair tie-downs in a space used for wheelchairs. Now let's look at tracheotomy tubes and feeding tubes. The tracheotomy tube is inserted through a surgical opening into the trachea or windpipe to facilitate breathing. Feeding tubes pass food and fluids from a battery-powered pump directly to the stomach through a surgical opening or through the nostril. The student will need extra help boarding and disembarking the school bus. Extra care should be taken when securing students to make sure that the tubes never become pinched or blocked. A rough ride could dislodge the tracheotomy tube. Bluish mouth or fingernails, chest rattle, or an inability to cough are signs of blockage. Care must be taken that the feeding tube does not become pinched or dislodged. A feeding tube failure could become a medical emergency. Let's talk about lap trays. Some students will have lap trays attached to the wheelchair. The lap tray must be removed before securing the wheelchair. The lap tray should be stowed in a safe location. Once again, lap trays, crutches, walkers, canes, and any other assistive equipment that we transport must be stowed and tied down with a seat belt or wheelchair tie-down so they do not become projectiles in an impact. In this section, we are going to go over the Child Safety Restraint System, better known as the CSRS. According to the National Highway Traffic Safety Administration, a seatbelt is insufficient for preschool-aged children weighing less than 50 pounds. A federally approved age and weight child safety seat must be used. Unapproved seating devices such as infant feeding seats, tumble form positioning seats, and strollers are not permitted. The student's IEP team will decide what type of child safety restraint system the student will need. The Transportation Department will get a request for special transportation form from the IEP team. It will outline all the special accommodations that the Transportation Department must provide for the special needs student. The driver will get a copy of the transportation request form, a profile sheet, and the information is also printed on the route sheets. Remember, the driver is not allowed to change the type of CSRS that the student uses. Only the IEP team can change the equipment that the child needs. If there is a problem with any type of equipment that the student is using, you must contact your supervisor. The IEP teams have decided that the Betsy seat and Star seat are interchangeable because they do the same job. So they are allowing the driver to decide which will work best for their bus. Here are some things to remember about child safety restraint systems. Always install and use all equipment per manufacturer's instructions. If you don't know how to use it or install it, ask someone. Never place a child in equipment that is not assigned by the IEP team. If a driver or transportation assistant has concerns about the appropriateness or fit of a CSRS, it should be reported to a supervisor immediately. Now we are going to go over the child safety restraint systems most commonly used by Fulton County schools. They are the Star seat, the Betsy seat, and the safety vest. Due to changes in technology and safety features, there are several styles of Star seats, Betsy seats, and safety vest. In this video, we will go over the Super Star seat, the Betsy seat Protect 4, and the Betsy safety vest. Let's start with the Super Star seat. Before installation, the Star seat must be examined for any damage. Pay special attention to the buckles and all the webbing. Locate the FMVSS label and manufacture date. The Star seat is good for 7 years from the date of manufacture. We cannot use the Star seat if it is missing the FMVSS label. Choose a seat that is appropriate for the child's needs. The best practice is to not install them on the aisle or near an emergency exit window. Lay the cam webbing across the seat back. The cam webbing on the bottom and back of the Star seat goes through the seat butt and around the seat frame, and should hang freely with no twist. The gray webbing in the front of the Star seat goes around the seat bottom. The cam straps should be hanging freely, fully extended, and have no twist. Take the gray strap around the seat bottom and hook it to the gray cam strap. Hook the black straps around the seat frame to the left and right cam hook. The straps should be hanging freely and not crossed. Tighten the star seat to the bus seat by pulling on the webbing at the cams, starting with the center, then the right and left cam. Stow the excess cam webbing in the plastic clips. If the clips are broken or missing, the webbing should be allowed to hang freely. Next, check the star seat base. Make sure that it has no more than 1 inch of movement. To get the star seat ready for the student, loosen the harness, unfasten the chest clip, and release the left and right seat belt. All heavy jackets and coats must be removed before placing the child in the star seat. Bring the harness around the student's shoulders and fasten the chest clip. Slide the chest clip to armpit level. Fasten the left and right tongues of the seat belt into the buckle. With your hand under the chest clip, pull the center webbing and tighten the harness to the child, ensuring that the chest clip remains at armpit level. Slide the shoulder adjustments down so that they are just above the student's shoulder level. The harness should come across the student's shoulders. The chest clip should be even with the student's armpits, and the seat belt should come across the student's hips. When properly tightened, you should not be able to pinch more than 1 inch on the shoulder harness. Now let's go over the Betsy Seat Protect 4. First, we must examine all the webbing on the 5-point harness and the cam straps, ensuring that there is no damage. Find the FMVSS label and manufacture date. The Betsy Seat Protect 4 is good for 6 years from the date of manufacture. If the FMVSS label is not present, the Betsy seat cannot be used. Choose the bus seat to install the Betsy seat on that best fits the student's needs. Best practice is to not install the Betsy seat on the aisle or near the emergency exit windows. Raise the seat bottom. Lay the cam strap across the back of the seat. Holding the bottom of the Betsy seat up, allow the bottom cam straps to hang freely. Lower them so they go around the frame and close the seat. The bottom cam strap should go through the seat bite around the frame. This should be straight and have no twist. Buckle the large cam strap around the seat back and the seat frame. There should be no twist, and the buckle button should be facing the back of the seat. Fasten the small cam strap around the seat bottom, ensuring there are no twists. Push down on the Betsy seat bottom at the seat bite and tighten the bottom cam strap. There should be an indentation on the front of the seat bottom. Keeping a hand on the Betsy seat bottom, tighten the back cam strap. There should be an indentation on the top of the seat. Stow the excess cam webbing in the plastic clip. If the clip is missing or broken, the webbing should be allowed to hang freely. To get the Betsy seat ready for the student, unfasten the chest clip and undo the right and left seat belt. Extend the webbing by pushing on the gray friction grip and pulling on the harness. If the student is wearing a heavy winter jacket or coat, it must be removed before they get into the Betsy seat. Make sure the shoulder harness is routed through the right slot. It should be routed so that it is just above the student's shoulder. Bring the harness around the student's shoulder and fasten the chest clip. The chest clip should be at the student's armpit level. Fasten the left and right seat belt tongues into the buckle. Tighten the harness by pulling on the right and left webbing loops. To make sure the harness is properly tightened, there should be no more than 1 inch of play when the harness is pinched at the shoulder level. Make sure the harness is slightly above the student's shoulder. The chest clip remains at armpit level, and the seat belt rides across the student's hips and waist. The chest clip should be snug against the child's chest. Now we'll go over the Betsy safety vest. Find the FMVSS label with the manufacture date on the inside of the cam, and inspect the cam for any damage. The cam is good for 6 years from the date of manufacture. Find the FMVSS label with the manufacture date. It's sewn on the inside of the safety vest. The safety vest is good for 6 years from the date of manufacture. The safety vest and cams are all numbered and should be kept together. Now let's install the cam. Choose a seat that's best for the student. Best practice is not near an emergency exit window and not on the aisle. Lay the cam across the seat back, with the hooks facing up. Raise the seat bottom. Rot the cam around the seat frame, making sure that it is not twisted, and close the seat bottom. The release button for the cam buckle should be facing the back of the seat. Buckle the cam around the seat back. Make sure that the cam is straight and it has no twist. Holding the cam at the top of the seat, tighten the cam to the bus seat by pulling the excess webbing. There should be an indentation on the top of the bus seat. Stow the excess webbing in the plastic clip. If the plastic clip is broken or missing, the webbing should be allowed to hang freely. The webbing with the bottom cam hooks should be at the seat pipe. Let's get the safety vest ready for the student. Unzip the safety vest and unfasten the crotch strap. If the student is under 25 pounds or the crotch strap is sewn in, it must be used. Holding the safety vest by the top D-rings, have the student reach through the arm loops. Zip it up on the appropriate zipper so that the safety vest is snug around the student. Remember, all heavy coats and winter jackets must be removed before placing the child in the safety vest. With the crotch strap fully extended, reach between the child's legs. Then fasten the crotch strap to the clips on the side of the vest. Once fastened, snug the crotch strap to the student by pulling on the excess webbing. The top strap of the safety vest should be at the student's sternum. Walk the student to their seat and have them sit down. Have the student lean forward and start with the outside D-ring, clipping it to the cam, then the top D-rings, and then the inside D-ring. The safety vest must be attached to the cam at all 4 D-rings. Make sure the top strap of the safety vest is still even with the student's sternum. If a student is sitting in a seat behind an occupied child safety restraint system, they must be secured in some form of child safety restraint system or a seatbelt. Here are some things to remember. A child safety restraint system should only be used per manufacturer's instructions. Safety seats should be installed and tightened adequately before the students are picked up. All equipment should be checked for expiration dates. Checking all child safety restraint systems on a school bus is part of the special needs pre-trip. If a child is sitting behind an occupied child safety restraint system, they should be secured. And never place a child in equipment that is not assigned by the IEP team. Now we're going to discuss the most complicated part of special needs equipment, the wheelchair. We'll go over how to properly load and secure the wheelchair. There are many kinds of wheelchairs, ranging from manual to electric. They range widely in cost from hundreds of dollars to tens of thousands. Wheelchairs can have a variety of extra features such as lap trays, tilt and recline options, various anterior chest supports, joysticks, and different head and footrest. You should use a wheelchair safety checklist to make sure the wheelchair is safe to transport. Make sure the brakes hold and are functioning properly. Headrest on the wheelchair is attached and positioned. Seat and back are attached to the wheelchair frame. Harness or trunk support system is attached. Trunk support system is holding the student in the wheelchair. Make sure the wheelchair does not appear to be too small or too big for the student. Make sure the footrests are in good working condition. Make sure the anti-tip bars are in place and functioning. Make sure the lap belt is auto quality, not Velcro. Make sure the wheelchair tires are properly inflated. If the wheelchair is electric, the battery must be clean and secured and identified as a gel or lead acid. With all the different types of wheelchairs and the extra features they may have, it is extremely important for you to know the wheelchair you are transporting. Don't risk the student's safety. If you are unsure about a wheelchair or its features, get help. Now we're going to go over how to properly load and unload a wheelchair. We will be going over the loading and unloading procedures, the correct use and operation of a wheelchair lift, the use of the 7-point securement system, and a seating plan for your wheelchair students. Go through your normal stop procedures. Your red 8 ways need to be on, and your crossing gate and stop arm need to be deployed if you are loading or unloading a wheelchair anywhere except on school property. Exit the bus and secure the lift door to the side of the bus. Let's pause and talk about lifts. All lifts have an outboard roll stop, an inboard roll stop, and the bridge plate. When the bridge plate or deck of the lift is even with the bus, the inboard roll stop will be down and on the floor of the bus. When the bridge plate is deployed completely to the ground, the front roll stop will be lowered to the ground. If the bridge plate is not even with the bus or the ground, both roll stops will be in the up position. This is a safety feature that helps prevent a wheelchair from rolling off the lift while it is in midair. All wheelchair lifts have interlock devices preventing operation of the lift or the school bus when it is not safe. All wheelchair lifts must be able to be manually operated in case of a power or equipment failure. Wheelchair lifts are designed for safety, but staff must be trained to operate those lifts. Injuries are possible, therefore drivers and transportation assistants must be thoroughly familiar with manufacturer's instructions. Only a driver or transportation assistant should operate the lift. Some common lift mistakes include allowing any distractions while operating the lift, drivers and transportation assistants riding the lift with the student, children standing and riding on the lift, adults operating the lift with dangling jewelry, clothing, or long hair, which can get caught in the lift mechanism, allowing children or untrained adults to operate the lift machinery. Then deploy and lower your lift, making sure that the roll stops are working. Perform your wheelchair safety checklist, then place the wheelchair on the lift facing out. Lock the wheelchair brakes, then secure the safety belt if your lift is equipped with one. Keeping a hand on the wheelchair at all times while the lift is in motion, raise the lift to the bus level. Make sure the front roll stop comes up when the lift leaves the ground, and the rear roll stop drops when the lift is level with the bus. Hand the wheelchair off to the driver or transportation assistant on the inside of the bus, or have a parent or teacher hold it if you are by yourself. There are 3 wheelchair positions on the internationalized buses. Wheelchair position number 1 is directly behind the driver. Wheelchair position number 2 is directly behind wheelchair position number 1. Wheelchair position number 3 is directly behind the lift and across from wheelchair position 2. With the wheelchair in position number 1, 2, or 3 with the brakes locked and centered in the rails, we will get out our 4 tie-downs. Always position the wheelchair and rider facing forward. Most sudden stops are in forward direction and most crashes are frontal. In emergency stopping situations, the student is thrust in the direction that the school bus is traveling. Tie-down straps should be attached to D-rings or to points on the main frame of the wheelchair near welded joints. They can also be attached to other structural areas where the frame is fastened together with hardened steel bolts indicated by 6 raised lines or bumps on the bolt head. The rear straps should be at a 30 to 45 degree angle to the floor and on the inside of the rear wheels. The front straps should be at a 40 to 60 degree angle to the floor and on the outside of the front wheels. You must use a 7-point tie-down system to secure the wheelchair and its passenger to the bus. Lock the front tie-downs into the outside rails. Hook the tie-downs to a D-ring or an appropriate welded or bolted joint. Lock the 2 rear tie-downs onto the inside rails. Hook the tie-downs to a D-ring or an appropriate welded or bolted joint. The shoulder belt must be attached to the vehicle. The lap belt can be attached to the wheelchair 4-point system or to the vehicle. The lap belt should come across the student's hips, and the shoulder belt should come across the student's chest and collarbone, not their neck. Attach the belt dispenser to the outside rail, approximately even with the rear tie-downs. Attach the shoulder belt to the side of the bus on the top rail. Attach the buckle side of the seat belt to the inside rear tie-down. Weave the buckle between the seat bottom and back on the inside of the frame. Weave the tongue side of the seat belt between the seat bottom and back on the inside of the frame and attach it to the outside rear tie-down. Buckle the seat belt. Place the buckle on the student's hip and pull out any slack in the belt. Make sure the lap belt comes across the student's waist and the shoulder belt comes across their chest and collarbone, not their neck. Tighten the wheelchair tie-downs by releasing the wheelchair brakes and pushing the wheelchair forward, back, side to side. When properly tightened, the wheelchair should not move more than 2 inches front to back or side to side. Reapply the brakes. The last thing you should do is check all 7 points of your tie-down system. Now that the wheelchair is tied down, it is safe for you to stow the lift and close the lift door. Now let's watch how to unload a wheelchair at school.
Neutral, turn the bus off, and then back on again. Open your door, unbuckle, get off the bus, open your lift door and secure it, and deploy the lift. Leave the wheelchair student secured while you deploy the lift. Get back on the bus, all ambulatory students off first, and then wheelchairs. Start with the lap belt first. Press the red release button on the buckle. Go to the front, left tie down. Push down on the red release button, pull the hook off and let the belt retract. Release the red button and pull up on the plunger to remove the tie down from the track. Set the tie down aside. Proceed to the right and remove the belt from the wheelchair. Leave the tie down in the track. Go to the back of the wheelchair. Unfeed the buckle. Undo both left and right tie downs. Undo the seat belt and unthread the seat belt. Be careful not to hit the student. Release the brakes and wheel the wheelchair out on the lift. Make sure the wheelchair is centered. Once it's centered, apply the brakes or power down. Get off the bus and lower the student down to the ground. Wheel them to the teacher, reattach the safety belt, and close the lift up. Check your bus, buckle up, close the door, and you're ready to start the next run.
Here are some things you should remember about securing a wheelchair. The wheelchair should always be forward facing. The brakes should be set or the power should be off on electric wheelchairs when you are done. Tie-downs should not be attached to wheels or movable parts on the wheelchair. When the tie-downs are properly tightened, there should be no more than 2 inches of movement front to back or side to side. It is the ultimate responsibility of the school bus driver to recheck and make sure the wheelchair and the student are properly secured before moving the school bus. Remember, any small mistake in the wheelchair tie-down could result in the student's injury or death. So if you are not sure, get help. Let's talk about some loading and unloading responsibilities. The driver is responsible to safely load the student onto the school bus at both the school bus stop and at the school. At the destination, the driver must safely unload the students off the school bus. The driver is responsible to have all the equipment that each student needs and know how to install and use that equipment properly. If the driver has a transportation assistant, they should work as a team. The transportation assistant is there to help the driver with the student. This includes loading and securing the student. The driver is responsible for how the equipment is used and should be checking the transportation assistant's securement. If the student needs help up the steps, the driver or transportation assistant should be behind them when loading. When unloading, they should be in front of the student. If it is necessary to get off the bus to help the student or operate the lift, the best practice is to have the transportation assistant get off the bus and the driver to remain on the bus. What happens when things don't go as planned? In this section, we'll be talking about unexpected situations. Unexpected situations can fall into 2 groups: non-emergency situations and emergency situations. Here are some examples of non-emergency situations. A student comes out in a regular child stroller instead of a wheelchair. A wheelchair or a safety seat are the inappropriate size for a student. Being asked to give a student medication against policy. Being asked to deliver equipment, but not the student. Being asked to do an unauthorized drop-off. Those are just a few examples of unexpected situations. I'm sure every driver could come up with more, and the list could go on for some time. So what should we do when unexpected situations arise? The first thing is to stay calm. Then contact dispatch and request instructions, or contact your supervisor. Unusual situations can arise with special needs students, and most of the time we try to accommodate them. But the driver must call for approval. Remember to always keep dispatch and your supervisor informed. When transporting students with special needs, many emergency situations can arise. One of your students may have gotten out of their CSRS. A student may be undressing. A student may be having a medical emergency due to an underlying health condition, such as anaphylactic shock, where the student is having an extreme allergic reaction to a bee sting, food, or something else. Asthma, where your student cannot catch their breath or is having problems breathing. Diabetes, where the student can show a range of symptoms: anxiety, headache, blurred vision, hunger, abdominal pain, profuse sweating, disorientation, slurred speech, and seizures. Hemophilia. A student with this may scratch themselves and not be able to stop bleeding because their blood won't clot. Remember, many underlying medical conditions can become life-threatening. What should we do in an emergency situation? The first thing you need to do is stay calm, then safely pull over and secure the bus. Contact dispatch. Give them your bus number and location. Request medical assistance if you need it, and further instructions. Administer first aid if the student needs it, but remember, only to the training you have received. With confidentiality requirements, Transporters may not be informed of every medical condition. For this reason, drivers and transportation assistants should always practice universal precautions. Remember, if you encounter a situation that you hadn't expected, stay calm. Your first response should be to contact dispatch and request instructions. You don't want to jeopardize the safety of the student or other students on the bus by transporting them inappropriately. In addition, a delay in notifying dispatch may jeopardize student safety in a medical emergency. And remember, stay calm. If you panic, your students will. Now we're going to go over emergency evacuations. Is evacuating a special needs bus different than evacuating a regular ed bus? The short answer is no. Both drivers get their students off the bus to a safe location as quickly and safely as possible. With a special needs driver, many more things come into play. Because of their students' exceptionalities, they need a specialized emergency evacuation plan. Emergencies happen without notice, so plan in advance. Careful planning for emergencies is essential with special needs. So, what is an emergency evacuation plan? It's a detailed handwritten plan on how to evacuate every special needs student off the bus. There should be a different evacuation plan for each school that the special needs driver services. There are many things to consider when creating your plan. Are you by yourself or do you have a transportation assistant? What are the students' abilities? How will the students react in an emergency? Does the student have essential equipment? Are your students in a CSRS or a wheelchair? Do you have an up-to-date emergency folder? The time to get together your emergency evacuation plan is before you need it. So plan ahead. If you have a transportation assistant, they need to help you with your plan. What are your students' abilities? Are they able to help? Or will they need more help? Are they ambulatory? Can they walk on their own? Or are they in a wheelchair? How will your students react in an emergency? Do they run because of the loud noises? Does your student have essential equipment, such as an oxygen tank that needs to go with them? Are your students in a CSRS or a wheelchair? Should I leave the student in the car seat? Is there time to use the fire suppression blanket? Do you have an up-to-date emergency folder? The emergency evacuation plan should include an up-to-date seating chart for each school, a written evacuation plan and how to evacuate each student, a student profile sheet for each student that has all emergency contact information and possible medical conditions that a first responder may need. This is all kept in a red emergency folder so that you have quick access to it when an emergency happens. Here are some general guidelines for an emergency evacuation. Stay calm. Secure the bus by putting the transmission in neutral, setting the parking brake, and turning off the ignition. Contact dispatch. Give them your bus number, location, report the type of emergency. Let them know if you need medical assistance and that you are evacuating the bus. Tell the students what is happening. Use simple words and directions. Something like, "We are getting off the bus and going to a safe location." Cut all belts and harnesses. If the student is in a car seat, you should cut the cam straps and carry them out in the car seat. Let's pause there. A car seat is like a traditional car seat, except it is fitted to the bus seat, and the student must remain in that during the evacuation. Typically, Fulton County does not use car seats. They use Betsy seats and star seats. In an evacuation, for a Betsy seat and a star seat, we cut the 5-point harness. Let's look at how to do that first on the star seat. Hold the chest clip. Diagonally cut the harness straps and pull the chest clip. Let's see that one more time. Now let's look at the Betsy seat. Hold the chest clip. Cut both straps diagonally under the chest clip. Pull the chest clip. If the student is in a safety vest, you should cut the cam strap below the buckle and leave the student in the safety vest attached to the cam. Let's see what that looks like. Cut the cam below the buckle, then the student can stand up. While holding onto the buckle, the student can be walked off the bus. Request assistance from bystanders. Even if you have a transportation assistant, bystanders can help you. If a bystander is assisting, tell them where to take the students and of any conditions the student might have, such as hold Jane's hand so she doesn't wander away, or John needs help walking. Remember, wheelchair students are evacuated last. Cut the wheelchair's seatbelt or upper body harness that holds them into the wheelchair. If they are small, carry them out. If they are too big to carry, use the fire suppression blanket. Holding the student under the arms and then holding the blanket, drag them to the appropriate exit. And don't forget to take your emergency folder. It has information first responders may need. Here are a few things to remember about emergency evacuations. Keep your seating chart and evacuation plan up to date in the red emergency folder. If an emergency happens and it's not up to date, it's too late. Non-ambulatory students get evacuated first, then wheelchair students. Cut all belts and harnesses. The driver and the transportation assistant should work as a team. Get help from bystanders. Know your students' abilities and their disabilities, and know your equipment. Transporting students with special needs is a team effort. Let's talk about team communication. Who do we have on that team? Well, there's drivers and transportation assistants, assistant supervisors and supervisors, school administration, teachers, school nurses and aides, parents and guardians, and the student themselves. Communication between the school and transportation staff is essential. School personnel, including school nurses, can provide accurate and up-to-date information about a student's disabilities, including specific strategies and tips for safely transporting the child and managing behavioral problems. Also, school staff may need to know the status of a student's bus ride. If problems have developed or an incident has occurred, school personnel should be informed at once. The safe transportation of students with special needs is highly dependent on open, professional communication between the driver and the monitor team, the students, the school staff, the transportation staff, and the students' parents. When we remain professional, our communication is credible. Some characteristics of professionalism include attitude. Make a choice to remain courteous, good-natured, and positive. Try not to become frustrated or angry. Competence. Make every effort to become informed about each individual student and skilled in taking care of their needs while they're on your bus. Commitment. Remain focused on your job responsibilities and consistently carry them out. A large part of commitment is to have excellent attendance, which provides stability for our special needs students. Language. A professional special needs driver and transportation assistant will refrain from cursing, making demeaning comments, or discussing inappropriate topics on the bus. Remember, you also speak with your body. Try to keep your body language positive. Integrity. In transportation, we are entrusted with the care of children. If there is a problem, an issue, a mistake, or a concern of any kind while transporting children, we are honest about it. Sensitivity. We must understand and use sensitivity when working with these special students. Use respect at all times. Here are some sensitivity tips. Remember, special needs students are children, not their disabilities. Not all disabilities are the same. There is a wide range of function with disabilities. Don't be afraid of a child with a disability. A child with a disability is not sick. Be understanding and avoid being overprotective. Help children with disabilities to be as independent as possible. Promise only what you can deliver. Try not to treat a student with disability differently than any other student. Ask permission to assist. Never assume a student with disabilities is unable. Remember, the disability is the smallest difference. We are all the same inside. Don't let your own expectations become someone else's limitations. Don't be afraid to laugh with them. And avoid causing embarrassment to the students. Be patient. Special needs drivers and transportation assistants identified 4 elements of effective student management: consistency, firm, fair rules, positive attitude, and modeling respectful behavior. Consistency. Drivers and transportation assistants report students respond well when the same rules apply every day and students are treated in the same way every day. Firm, fair rules. Drivers and transportation assistants report students who know the expectations from day one settle into the routine of a daily ride in a shorter period of time and with lasting results. Positive attitude. Successful drivers and transportation assistants list a positive attitude as one of the most important ways to improve student behavior. Simple approaches to establishing positive rapport with students include smiling, greeting every student by their name, and showing an interest in each student. Expressing appreciation for good behavior was also reported as very effective. Modeling respectful behavior. Drivers and transportation assistants reported that successful student management is more successful when they are role models for treating others well. A positive attitude, sense of humor, professional appearance, and respectful use of language. Maturity and self-control is reported as effective with students. Remember, transporting students with special needs is a team effort. This course is not, in any way, meant to be a special needs school bus driver certification. It is just an introduction to special needs. It is intended to inform all school bus drivers of the responsibilities that a special needs bus driver has. So let's all give them a big hand and know that this is just the tip of the iceberg.